Is your toddler too attached to you? My name is Dr. Aisha Bailey. I'm a pediatrician, and one of my favorite things to talk about is social and emotional development. Um, I see tons of patients day in and day out, and I know that especially where we are in the world right now with events and everything, I have a lot of parents thinking about social emotional development, how important it is. And one of the most important developmental groups that we have right now is toddlers. And so that's what we're going to talk about tonight, specifically Velcro toddlers. I know this is this new trend that's developed. And so really what we're going to talk about is what toddlers do, what their outlook is in life because they have one, and because they need to be understood as the little people that they are. So for those of us who are just joining, again, tonight we're going to talk about Velcro toddlers and how you may be hindering them socially and why that really matters at this point. I know the Velcro term is more of a new term, but again, it's really something that needs to be discussed, and a lot of parents are going through this. You are not alone. My name is Dr. Aisha Bailey. I'm a pediatrician, and I will also say that toddlers are some of my favorite patient groups as a pediatrician. I absolutely love toddlers. As a parent, it's a struggle. It's very hard. And so I definitely, commend anyone who's going through raising a toddler right now, who knows somebody with a toddler, but knowing someone with a toddler and actually being a parent to a toddler are two different things. So first off, let me get into toddlers and really what they're about, okay? So toddlers are rebels with a cause, and I want you to remember that. The reason is because they're born as infants, and you're so happy that you have this beautiful infant who's sitting in your lap and who you can hold for hours and who looks at you and you look at them, and it's just so amazing and it's so beautiful. And then they learn how to walk. And then what do? They start trying to pull away. And that can be disruptive if you're a parent. It can be disorienting. It can be concerning. And not only do they pull away, they get annoyed with you, right? So you may notice you have once the 12 months, they're kind of, toddling. In some cases, they're walking fast. But when we get to that 15 to 18 month period and you're trying to grab them up, they start wiggling, they start getting away, and they're like, leave me alone. Like, I have to go see things. The reason why does not have to do with you, and it doesn't mean that they don't love you. It's really about self-discovery, okay? I need you, if nothing else tonight, you really realize that that is what your toddler is about. And there are a number of things that they do to really show that they are discovering themselves, okay? So one, toddlers, again, are rebels with a cause, and that cause is self-discovery. One of the first things they do, and you'll know this, when they're about around 18 months to 2 years of age, what do they say? Mine. And they may walk up to a child and grab a toy, and then they take it and they smile. Now, in this moment, I do want you to know that when this happens, as a parent, you're mortified, but I need you to understand why they do it. Toddlers, because they're talking about self-discovery, have actually mastered this thing where they are advocating for themselves. They know what they want, they know when they want it, and if they see something, they take it, and they take it for themselves. So even though we're talking about social practices, and again, that goes against the social norms, and they're toddlers, they don't really know what our agreed upon social norms are. You still want to discipline effectively, right? And actually, and remedy the situation if they've taken away a toy, but you still want to give that resilience. You want a child who's going to be able to advocate for themselves, who knows their wants and their needs, and who advocates for them. So you really have to respect toddlers, love them, and still discipline them. And that's that fine line that you're going to be walking as a parent with toddlers. And I do want you to know, for those of you who have joined tonight, we're talking about Velcro toddlers. I know a lot of you are going through it right now. I commend you for it. My name is Dr. Aisha Bailey. I'm a pediatrician. but this is just something that we have to talk about. It's just been on my mind for too long. So, mine. When toddlers say mine, the reason why they're saying that is, again, because they are rebels with a cause, and that cause is self-discovery. And when they say mine, they are establishing their wants and needs immediately, and they are advocating for themselves. So again, you want to support that, but you also want to discipline accordingly, right? So that's the first thing that they do. The second thing is that push-pull. The push-pull is just what toddlers do. And you know this. You start off with this beautiful little baby that sits in your lap for hours. And then all of a sudden, what happens? They start walking. And then they start exploring. And you know this. You'll go to someone's house, you put your toddler down, and then they start running. And like a second later, they go to the most dangerous thing in the room. And you're going, oh my gosh, I can't even believe this. This is normal, right? And not only that, they want to get away from you. Let's say if you're in a place and you're like, sit on my lap. They're like, I don't want to sit on your lap. They start, crying, wriggling, getting out there, like, leave me alone. This is what you want in a way, right? There are instances where that doesn't work, but they're really trying to establish their independence. They are trying to explore the world on their terms. And you really have to respect that, right? And even though I say it's respect, it doesn't mean that you just kind of let them run roughshod and do all sorts of crazy stuff, but that is what it's about. So we have self-discovery, we have the fact that they're trying to establish their wants and needs and seek independence. Now, I said push, which means that they're going to push away from you, and you know that. They'll go run, and then they'll explore, and then what do? If something scary happens, they come right back to you. That is the relationship that you want with your toddler right now. So the relationship that you have with your infant, where the infant may sit in your lap all day and it just stays there and sits there and you sit and look at it, it's beautiful. But as a toddler, that is not what you want your child to do. You want your child to see you as home base, right? Your toddler loves you, by the way. There's nothing new to this. You want your child to love you, right? You want to be that foundation, but you want your child to feel confident enough to explore the world just briefly, then come back to you. And that umbilical cord will lengthen hopefully over their lives so that they end up just coming back, right? But you're home base. So remember that you guys are home base. But at the same time, you don't need your toddler there all the time, right? And you don't want your toddler there all the time because you're going to stunt them socially. Okay. Next is no. And I know you guys know what this is. So for those of you who are just joining, we're talking about Velcro toddlers. My name is Dr. Aisha Bailey. I'm a pediatrician, and we're just getting into the things that make toddlers toddlers and understanding them a little bit. And then I'm going to get into this Velcro toddler thing. So no, your toddler understands no. And what do? They fight against it. And you know this. So again, that same instance where let's say you take your child somewhere, they're going to a friend's house, and then all of a sudden, let's say you see them in the distance and they've taken off and they're getting ready to touch something, right? And you're saying, no, do not do that. Don't touch it. Don't touch it. And they're looking at you and they're seeing you say no. And of course they touch it, right? And you're mortified. You're maybe running after them because they're disobeying you, right? But no is also part of that, where they are exerting their control, they're expressing their wants and needs as well, and they're going to do whatever they want to do, and they're pushing those boundaries. That can be disorienting to parents who are used to having nice little infants that listen to whatever they say. That is not toddlers. Toddlers are there to push those boundaries because they're experimenting. So I'm going to take you guys back to like 9 to 12 months of age. When you had a baby that was picking stuff up and dropping stuff over the side and looking, and picking stuff up and dropping stuff over the side. They learn through experimentation. And they have to learn through experience. And what that means is that if you set those boundaries, they're going to push against those boundaries just to see how far they can go. But what that also means is that as parents, you really have to remain firm with them, right? You don't have to be mean, but just firm, right? If they don't want something and they're pushing, you have to be that boundary and say no, right? So what that means is that when we get into tantrums, which by the way are completely normal at this age, if you have a child who cries and cries and cries because they're not getting what they want, you still have to hold firm, right? And so even if you have a partner, you may have one partner that's holding firm and another one that's like, okay, give them what they want. Don't do that, because you're only feeding in and you're building a monster who's going to haunt you for the rest of your life later. So you really want to hold that. You're not hurting your child by having those boundaries. You're actually helping your child because they know, okay, and you can do it in a nice way, right? And again, you may be annoyed at times, but you just want to hold firm so that you're that foundation of love and strong support. That is the most important thing, okay? So you have that push-pull. And then the last one, cause and effect. At this age, your children are not sociopaths, and I need to tell you this, okay? Because I have a lot of parents freaked out. So I'm going to give you a scenario. Let's say you have a toddler who's playing with a child, things are going well, and all of a sudden they hit that toddler or they bite that toddler. And you're going, I never taught them to do this. Where are they getting this from? And then let's say they start laughing and you are mortified with your child going, what is wrong? I taught them right from wrong. Why are they not doing what I taught them to do? And then you're starting to spiral as a parent saying, I'm doing something wrong. I've failed as a human being. The answer is stop and no. Kids at this age like cause and effect, right? If they push a button and a light goes on, they're like, woo, woo, and they'll do that over and over and over again. The same thing goes if they hit a child or they're biting a child. I'm not telling you that that's okay now. I'm not saying that you're like, oh, if that happens, you'll go, oh, that's okay. They're learning cause and effect. That's not what I'm saying. What I'm telling you is that really what you want to do for that child, right, is recognize where they're coming from. And then again, you curb the behavior. But it's the cause and effect. So they're not looking at someone's pain. They're just looking at the reaction. All right, so remember that. So I'm saying all this to say, now we're getting into the Velcro baby thing or Velcro toddler. So for those of you who are tuning in, again, we're talking about Velcro toddlers and if you're inhibiting your child from being social. So we've just kind of gone through what makes toddlers, which I love as a pediatrician, but as a parent, I really hats off to you if you're going through that right now. And now we're going to move into this whole Velcro thing that's happened. And again, if you guys like what you're hearing, please feel free to send me gifts because then I know that you actually enjoy this stuff. I'm going to keep talking about toddlers because again, it's one of my favorite age groups and then other age groups as well. All right, so what I started noticing really post-COVID, it was a couple of years ago, you're talking to families, and again, I'm talking to tons of families, finding out what's going on with them. And I'd start asking questions, right? And so I'd be like, well, who are you playing with? And, are your children playing with people regularly? Yes, Dr. Bailey, they are. Okay, great. And then I'd listen, and then sometimes I'd get things like, well, my child plays better with adults. Okay. And then I'd ask the age of the child in some cases if they were playing with children. Oh, well, they play with like a cousin who's 10 years old who is 12 years old, or they have a sibling who's 7 or 8. And I really started to get concerned because I was like, well, are they playing with any kids their own age? And I was really shocked by the number of people the number of toddlers who only maybe have one playmate their age, or in some cases, no playmates their age. And I understand what it was, right? It's post-COVID, and so people are afraid. They don't want, their kids to get sick, and I understand that. Even though I do have to say this as an aside, you have a toddler, and your toddler is going to get sick. Your toddler actually kind of has to, because their immune system has to start being primed, right? And so I do have some parents that are pulling their children back like forever until kindergarten because they think, well, if I just hold my kid back from being exposed to other people, they won't get sick. But the answer is when they go to kindergarten, that first year, they're going to get sick anyway, because again, their immune system has to get exposed. And then that's just what's going to happen naturally. Okay. So there's nothing that you can do to avoid that. But parents are afraid of their kids getting sick. That's one. And then at the same time with COVID, we got smaller in terms of our communities. So it was really just who you know, things like that. And so toddlers now, for the most part, and maybe it's different where you guys are, maybe you do something differently, but toddlers are essentially with their parents. Now, that's fine, but toddlers have to be social, guys. They have to be socialized. So for instance, as a pediatrician, I check all sorts of things in terms of development, speech, what have you. And what I find is the children that really aren't exposed to a lot of kids their age tend to have more delays, even if their parents are doing full-on curriculums, right? I get that. They're like, we're learning our numbers, we're learning our body parts, we're learning all these things. That's great. But toddlers especially learn through toddlers, and they especially learn through awkward toddler interactions. And we're going to talk about that a little later and why it's so important. So I noticed that parents were doing this. And at the same time, again, we were also noting during COVID, there were kind of more delays in terms of speech, social development, all sorts of things, right? These are essential for toddlers, right? Because they're talking about their emotions. And what I will say is, I want you guys to talk about your emotions, and I want your toddler to talk about their emotions. So if they're angry, you're like, are you mad? Yeah, I guess I'm angry. Have them vocalize their feelings. If they're sad, say that they're sad. If they're happy, say that they're happy. Get them to really vocalize and talk about it, because it's really important. And then I want to take it up a notch. If you or your partner, your family members are angry or sad or this or that, I want you to express that, so that your toddler also knows that other people also have emotions, right? Because again, as toddlers, we say that toddlers are rebels with a cause, and their cause is self-discovery. And that's very important, but they also have to understand that other people also have feelings and emotions and needs and wants as well, right? Even though they're at this age going to really acknowledge and advocate for themselves. Now, this is the last thing I'm going to say in this like COVID thing, and then we're going to get into the whole play thing. You as a parent have grown up in this world, but toddlers have not. Your toddler hasn't. And there are instances where toddlers are exposed to environments with a bunch of people their age, and they're in shock. And they're in shock because they've never seen another person their age. And actually, they really don't even know if there is anybody their age. So again, really what you want to do is expose them. All right, they have to be exposed. So we're going to talk about the venues and the ways that you can do that, because it is so, so, so important. Okay, the first venue is the playground. Now, I know that there are a lot of parents who may be hesitant to take their kids to the playground. I know I've had some parents voice some concerns about their children, just not being in a safe area or getting snatched or what have you. Look, I understand that as a parent, you may have anxiety about it, but you do have to understand that that is one of the easiest places to go, readily accessible, all different types of children, all different ages and stages. And you want to make sure that your child, your toddler, meets up with other toddlers. And you don't have to necessarily force the interaction. It's great if your friend has another toddler and they get together, great. But you still have to expose kids to different children, because we all have different ways of communicating and doing things. So you have to have your child exposed to that variety of children. Playground is your best bet. Now, when you go to the playground, I do want you to give your child a little bit of a distance. 3-4 feet, maybe 5 to 6. You're always going to stay behind them at a pace, but you don't want to be really right up on them, because you want them to explore, like we talked about, right? Toddlers like exploring. And again, you can do that in a safe environment. You're following closely, you're observing, so you have to be off your phones, you're focused on them, and you're looking at what they do. Now, let's say they meet up with another little person their age, and this is great. Now for those awkward toddler interactions, and this is what I'm talking about. Let's say your child sits down, sees another child. Now, one, if they do meet up and let's say they start playing, don't be surprised if your child sits next to the other child, not in front of, but kind of next to the other child, and that he or she plays with their toy and is just kind of looking at the other child play with their toy. That's called parallel play. And it's what toddlers do, and it's completely normal, okay? So I don't want you to try to reposition your child like they're not making eye contact, like this is a sign and a warning. It's completely normal. Okay, so if that's the case, they're learning from somebody else who's right beside them. It's parallel play, and that's normal. Now, let's say your toddler does exactly what I said earlier on, where they walk up to a child and they take a toy and they say, "Mine." What do? All right, I don't want you to freak out, okay? Because again, we talked about what toddlers do. This is inherent toddler, right, stuff. So what you do is you just calmly say, "Hey, we don't do that." You take the toy, right? You give it back to the child, and then you talk to the other parent, and you say, "Hey, we're working on sharing." Now, here's what I want you to do. If you can, I want you to think of yourself as a coach, not as a parent in this time, a coach. And so what do? You debrief. Maybe you take your toddler away just a little bit, but you're still on the playground. I don't want you to take him to the car and take him away from don't do that. And then what you do is you just explain, "Hey, that's not what we do, and that's somebody else's toy, and that's that." Just keep it simple. Now, if all of a sudden they start screaming, they start crying, they start flailing and all this stuff, and you're already stressed out, I want you to take a deep breath and wait for them to go through their tantrums. That's it. Let them have their tantrum. Because what they're doing is they're really just releasing a lot of the emotions that they have. And that's fine. If they're young enough, you can distract them and say, "Hey, look over there." And then they may look and then they're distracted and then you can get them back out. But I want you, no matter what you do, you're going to put your toddler back with that toddler to play again. I have heard too many stories of parents who are like, "Look, things were good. Everything was good. Their hands were clean. Their clothes were pristine." I'm going, okay. And then they're sitting down and they were playing and all of a sudden such and such hits such and such. And I just grabbed them and I took them out and I apologized to the parent and I was mortified. The answer is no to all of that. No. You know what your toddler is going to do. Your toddler is learning. And the thing is, if you take your toddler out like that and say like, "Oh my gosh, this is the worst thing ever," your toddler only remembers that. I did something wrong, I guess, and mom or dad freaked out and then took me out, and now I can't even be at the playground, and all I wanted to do was be at the playground, and that's going to cause them just to keep crying and crying, right? Because they just want to get back to the playground. And you really want them at the playground because that's where they learn. They learn through play, guys. That's what kids do. They learn through play. So don't take them back out. You can debrief. You're taking them to the sidelines. Then you're getting them back out there on the playground to play. And I don't want you to make them feel bad about what they do. It's just, "Hey, got it. We're moving on." And you know this, right? Like even at this age, if they trip and fall and it's a bad fall and this is the age, right? They'll look at you right after. And if you're like, "Oh," then they start crying. But if you're like, then they're like, "Okay, that wasn't that bad." This is the same thing. Just keep it moving. Just have them keep playing, okay? So that's that. If they start advocating, you just say, "Hey, we're working on sharing." That's it. And again, you're going to give them that safe distance. And again, if your child is clinging to you, if they're really nervous, then what I want you to do is you're going to hold their hand at first, right? Hold their hand, walk around the playground. They're going to start observing. Maybe it takes them a longer time to warm up. Just hold their hand and have them look around and then they will start warming up to other children. They may see other children having a good time, and then see if you can kind of put them down. And then what you're going to do is slowly distance yourself. Not a lot, but like 3 to 4 feet. They'll get distracted, hopefully playing with other children. You're seeing that they're nice and safe and they're enjoying themselves. That is a great interaction. And again, if they have any awkwardness, any craziness that happens, you're right there to pick them up. But at the same time, if you have a child that's especially clingy, try not to hug and hold unless they absolutely need it. You still want to keep that distance and have them, kind of exert some independence. And at the same time, it is so important to have them self-soothe, right? Because think about it. If they're 10, 20, what have you, they can't keep looking at you, right, to soothe them. They have to know how to self-soothe. All right. For those of you tuning in, guys, this is Dr. Bailey. I'm talking about Velcro toddlers and what you can do to help them with socialization. So, there are some other venues besides the playground. If you're nervous as a parent, I understand, but I still want you to use the playground. But there are some other things. You can also go to toddler playrooms, and I know that those are around the country, and you can find them. Now, this is what I would recommend. If you're going to a toddler playroom, because it tends to be a smaller space, more enclosed, what I want you to do, especially when your toddler's trying to go around and look for playmates, if you're with more than, if it's you, your partner, what I want you to do is one person at a time going with the toddler. And then again, giving your toddler a little bit of distance. So your toddler can kind of walk around, see other toddlers, see if they're interested, observe, and then start playing. Always maintain that safe distance, right? So that you can monitor them, but have them get out there and interact. That way, then they're not too overwhelmed. If you're too close to your toddler, then your toddler's not going to want to really distance themselves. And at the same time, they may feel your presence and they may be constantly looking at you like, what's going on? So please keep that distance if you can. A safe distance, but healthy. And again, I'm not saying that one parent stays with the child the entire time. You guys can always switch off, but just have maybe one parent as the home base at whatever table and you're resting, and then the other one playing, kind of being more of a chaperone. And then finally, there are libraries and bookstores that have toddler hours. Now, I love this, especially for more shy toddlers who are kind of slower to warm up. This may be perfect for your Velcro toddler, okay? And what that means is that it's semi-quiet, but it's a way for your toddler to observe other toddlers, right? To figure out what other toddlers are doing, to watch them interact with their families, and then at the same time, listen to stories. And after the toddler hour is over, your child actually may warm up, seeing that there are other children who like listening to the stories and who interact with their own families. That may be another way to kind of lower that threshold. But either way, what you really may want to do is just start giving that safe distance, because again, this is where they learn, and they really learn through those awkward interactions, guys. And what that means is they're going to get dirty, they're going to get messy, they're going to mess up. And what you want to do is still love them. You're still going to be that home base of love and support for them and understanding. And so that's why I really wanted to talk to you a little bit tonight about what toddlers are, why they do what they do. So again, if you're just joining us, I'm Dr. Aisha Bailey. We're talking about Velcro toddlers and why toddlers do what they do. Okay, so, but toddlers are essentially rebels with a cause. Their cause is self-discovery. And really what they're trying to do is kind of exert their control and advocate for themselves. And as parents, you want to be that supportive home base, offering love and support. You don't always need them on you. You really don't want to at this age. You want to give that quiet support and then offer a distance. And again, because they push-pull, they're going to pull away from you, right? They're going to push away from you, but then they're going to run back to you as soon as, right? So expect that to happen. Do not be deterred. You are going through this and your toddler's going through this. Please don't, start devolving and, getting depressed and sad. These are the things that toddlers do, and they do it so that they can become their own individual people who, again, advocate for their wants and needs as well. And as parents, what you want to do is still hold firm. Like if you say no, you mean no. It doesn't matter if they cry for 2 hours. They're going to be fine, guys, okay? But you're still saying no. You're maintaining that, and your toddler will respect that. But if you say no and then you change your mind as soon as they cry, you have a long road ahead, because then it's just going to get worse and they're going to go for longer and longer times. So these are the things that I really wanted to share tonight. In terms of Velcro, the reason why I think a lot of people are doing Velcro and talking about Velcro babies and all of these things is because COVID really caused us to shift. And because of that, we have smaller networks. And again, now I notice parents are trying to pick and choose who their children should see and who they should interact with. Just please try not to do that. We are all here together, and it really helps your toddler to meet as many different toddlers as possible, right? And sometimes even I'll have parents whose child is speech delayed a little bit, and they're nervous with having them around other children, and they're working day and night trying to help them, and we're going to speech therapy and all these things. That's fine, right? They still need the services, but get them out there still to other toddlers, because other toddlers will communicate with them in different ways. And they will also challenge them so that then your toddler is actually starting to progress. And I see that a lot where there are toddlers who may be delayed in some area. They start preschool or they start seeing toddlers their age, and then all of a sudden they start developing really quickly. So I really hope that this has at least helped tonight. I hope that it's given you more insight into your wonderful toddler. I'm going to have more lives on toddlers and their beauty and what have you, because like I said, as a pediatrician, they're one of my favorite age groups, but then as a parent, it can be very anxiety provoking. All right, guys, if you have any questions, feel free to DM me. I'm very happy to answer any questions. And again, I know that this is really stressful right now, being a parent to a toddler, and things have really changed. But even still, those are essential truths. The truths that I talked tonight will remain for toddlers. So I hope that gives you more insight. I will have more lives in the future, and thank you so much for joining us tonight. Take care.